I'll be talking about comparison of the various Okta machines and the economics associated with the machine. Okta is a non-invasive, rapid, in vivo cross-sectional image which tends to um, look at the dynamic microvasculature of the retina and the choroid. Although it's been there for almost 20 years now, but more importance has been there and it has garnered more wide acceptance in the past 8-9 years or so. Usually, the basic principle is it is similar to what we see in an ultrasonography. Ultrasonography uses sound, whereas Octa uses near infrared light, and it has two components. One is a kinetic component and a static component. So the moving RBCs and sequential photographs of that particular area against the normal non-moving surrounding structures like the retina, choroid, and the other vascular structures is seen, and then the machine interprets this image, and then it creates something like a network-like picture. So the the easiest simile which I can put forward is this video. If you look at it, it's a flip book which was commonly used for children. Now, if you just go through it again, you can see how multiple pictures of the same photograph, when repeated over a period of time, they tend to give you an illusion of motion, and that is what an Okta does. The various algorithms which are used, this is an exhaustive list. You do not need to really sit down and memorize any of these. It is just a basic physics and mathematical application of the thing which we utilize, and these are the names given to it. Then the other methods which it uses in order to amplify the images is speckle variation, variance, amplitude decorrelation, phase variance, a combination of both of these, and a probabilistic approach. So when I did not understand, I went back to the artificial intelligence. I asked it what exactly these meant, and it threw at me a multiple jargon of many things, which again confused me more. So what I did, I went back and just summarized it into 4 lines. So SD Octa, that is a spectral domain Octa, is a standard choice when we need a good resolution. SSADA is actually, if you go back, it's a split spectrum amplitude decorrelation angiography. This one enhances the image quality. When you have a swept source Octa, you have a better depth penetration, whereas a full field Octa gives you a wider field of imaging. The other parameters which are looked in are vessel density and the flow index. If you look at the difference between the A scans per second between the different machines, like a time domain OCT all the way till the Octa operates at somewhere more than 70,000 A scans per second, and the actual resolution which it provides is somewhere to the tune of 5 microns. So the image information which is acquired by the machine is dependent upon the shortest interval between two successive B scan images. So the shorter the distance, the higher is the resolution and the higher the sensitivity threshold. So if you look at the various machines available and only focus your attention towards this column here, Heidelberg has the minimum separation between two different B scans at the level of around 5.7 microns, and the highest is seen in the Canon machine, which is around 12.9 microns. So again, after taking these photographs, the software tends to average these photographs to give a clearer picture, which can be of two different types. Again, we cannot go into the details because it is going to be an exhaustive exercise for us. The only advantage of OCTA happens to be it is a non-invasive, a very rapid image acquisition technique, as opposed to an angiogram which takes around 10 to 15 minutes and an ICG angiogram which takes all the way till 30 minutes. This can be achieved in less than 5 minutes, taking something like about 6 seconds per image. Can be used in patients who are allergic to dyes, pregnant, or any other contraindications to the use of the dyes. And with the advent of the wide angle Octa, broader areas can be assessed, like in the newer machines like the Zeiss Plex Elite, which can give you sections as large as around 12 millimeter by 12 millimeter. The only limitations are that it is not a replacement, and I repeat, it is not a replacement for the dye-based angiography. Now, when we are used to seeing angiography, what we appreciate is the pattern of leak. Now, the problem is that when the movement of RBCs is slower than the resolution limit of the Octa machine, it does not register as a flow. That is why on Octa, microaneurysms do not show as a leak, or you do not see flow pattern on a microaneurysm, because the flow is very sluggish there. So, where do Octa machines stand in the present day and age? It adds to our different multimodal imaging techniques like a fluorescein angiogram, ICG angiogram. You have autofluorescence, you have to it near infrared, confocal blue reflectance. All of this added together with Octa will give you a broader picture, and it brings into different parts of the diagnostic puzzle, having its own strengths and limitations, as we had already discussed. The various machines which are available are again the extensive list, but I have just brought it down to three major players right now in the market which are available in India. One is the Spectralis, Merante, and the Plex Elite. All of them are exorbitantly pricey. The only difference between them is the wavelength which they use and the different slabs which are used. So the only thing is you cannot interchangeably interpret a machine information taken from a Spectralis as what you would do for a Plex Elite, because the slab which is used in the Spectralis is segmented at a different level as what is in the other two machines. To improve the image quality, we need to have something like a projection artifact removal tool, averaging of images, and also AI-based correction of the single image. Final tips and suggestions: that you always have to double check the flow in the B scan. You have to see for the change in reflectivity and always move the slab up and down. Economics, the answer always the big question: is it really for you? It depends on your area of practice and your subspecialty which you subserve. If you are in an institute, probably it is an indispensable tool for learning the new basics of the disease. The investment, is it worth it? And really, does it live to the hype? Yes, it does. But it does come with a pinch of salt. Thanking you.